Hi everyone. Now that we have understood the theory behind the medical certificate of the cause of death and some important Viva points, so let's now move on to the practical demonstration. In this section, I will show you how to fill an MCCD from step by step, explain what should be written in each column, discuss common mistakes of the student make during exam and Viva, and share a few practical tips to help you score better. So keep the MCCD form in front of you and let's fill it together one section at a time. So name of the MCCD form is medical certificate of cause of death. So there are the two types of the form, that is form number 4A and form number 4B. Form number 4 and form number 4A. This form number 4A is used in the hospital inpatient deaths, and form number 4A is used for the non-institutional or home deaths. Next, there is a name of the hospital, that is Arjikar Medical College is written, and you have to write a special point at the first, that is the certificate that person who is particularly given below. So died at the time of the date of the date and at which date, that is 9:30 am hours. That is this question. A problem will be given and you have to form that fill that form. So a 60 years old female, Miss Y, was admitted with a strangulated femoral hernia which has started 4 days earlier. She came complaining of the abdominal pain, high fever and fecal vomitus, and declared broad dead in hospital. On autopsy, it was found that there was the rupture of the lower ileal wall and peritoneal cavity contaminated with fecal matter, and patient has been on the antihypertensive drug for essential hypertension for 3 years. You have to fill all the given informations in the MCCD form, and I will demonstrate here. So first, this is not a broad death, so it is in the inpatient death. So we have write that died on this time and this. Next, we have the name of the disease. The name of the disease is Mrs. Y. You have to this. You have to not use any initials. So if the always write the name in the full names. In case of the baby who has not yet been named, write the son of or daughter of followed by the names of the mother and the father. So here given the sex, you have to mention the sex, and if 1 year or more year in the about age. What is the age of the death? So age of the death, there are the 4 columns are given. The age above 1 year, it is written in the completed years. Below the 1 year, you have to write in completed months. Below the 1 month, you have to complete in completed days. Below the 24 hours, you have to in completed hours. So now the important part of this MCCD, that is cause of the death. This section must be completed personally by the attending doctor or the given information as given here in this question. So MCCD part has 2 parts. You will see that the immediate cause, stating the disease, injury, complications, and the other significant condition, that is in part 2. So if a single disease completely explains the death, simply write the part 1A. If the disease is a sequence of the disease, part 1A the immediate cause of the death, part 1B the antecedent cause of the death, part 1C that is the underlying cause, the disease or injury that initiated the entire chain of the events. Here you can see the questions that the female admitted with the complaint of strangulated femoral hernia for 4 days earlier. It is not the immediate cause, so it will not be the 1A. So here is the rupture of the lower ileal wall. So this is not the immediate cause. This is, but it is antecedent cause. But the real real point, the part 4 peritoneal cavity contaminated with the fecal matter, that is means peritonitis, it is the immediate cause. So we write in 1a the peritonitis as the consequences of, and then we fill the B, that the rupture of the distal ileum due to or as the consequences of, and then at the last, that 4 days back, so we write the strangulated femoral hernia. So here is the point. If the less than 1, we have this form, this is the 5, this will be the field as the death, not as the if the less than 1 year is, not confuse this with the if less than 1 year age of the death. So write the time given in the point number 5, and then fill the part 2. Before filling the part 2, we have to remember that never write the cardiac arrest in these questions. In here the question is not about the cardiac arrest, so I did not mention the cardiac arrest. Here only write the peritonitis, but in other cases never write the cardiac arrest, respiratory arrest, heart failure or respiratory failure alone, because these are the mechanism of the death and not the actual cause. In part 2, that is the other significant conditions, mentions the other significant diseases that contributed to the deaths but were not directly related to the main change of the events. So important point is write only one disease on each line, that is given the 2 lines, so you have to write any two conditions and write disease names in the fully and clearly. That is essential hypertension, write is fully and clearly. Diabetes mellitus, write, do not write DM, or write diabetes mellitus. Mention the approximate time interval between the onset of each conditions and disease. That is, the patient is suffering from essential hypertension for 3 years, so I have write the 3 years in the point number 5. So this is a special situations. The manner of the death will be asked, that is it is natural death, so it is only natural death, but in case of the accident, suicide, homicide and other pending investigations, you should write this MCCD very cautiously, because the pending investigations are there and do not issue these MCCD certificate directly, and you have to face the medical legal consequences. It is a medical legal cases, so in the case of the suicide and homicide and pending investigation, so write pending investigations, so when you have applied for the police inquiry. So in accidental cause or violent deaths, mention both the injury and its external causes. For then if the decreased was female, here the decrease you can see the female, so was the pregnancy associated with that, you can see the age of the patient is 60 years and not falling under the reproductive age group, that is 15 to 35 years, so 45 years, so you have to write here that is the patient is not associated with the pregnancy, so no. And if you do the yes in case of the 15 to 45 years, if the disease was if the yes was you would have written the yes was the delivery, because you have to write yes or no depending on the case situation. And another important point, this is the old patient, you can see that is 60 years, so do not write the old age or senility as the cause of the death. If the specific disease is known, here the specific disease is known, that is peritonitis, so you don't write the old age or senility as the cause of the death. If a specific disease is known, if it only contributed, mention in part 2. Be the specific and always mention the exact diagnosis, so whenever possible. For example, types of the anemia, if the patient died of the anemia, type of the anemia, in case of the patient died of the malignant tumor, write benign malignant tumor, or in case of the tuberculosis, the organ affected in tuberculosis. In case of the dysentery, in road traffic accident, in case of types of the dysentery or road traffic accident or accidental deaths, and exact pregnancy complications, what is the eclampsia or preeclampsia or profuse bleeding or PPH, postpartum hemorrhage. You should write B and specifically what the cause of the death. Avoid writing only the symptoms. You have this. For next time, so you have this in the 2 point of the signature. One signature is for medical officers. You have to the full signature of the medical officer, full names in blocks, the capital, and use doctor designations, that is MBBS, MD, and etc. And you have to write the medical registration number. For you as the attending doctor, you have to write your signature, and same as the medical officer's doctor. I have demonstrated this. You have WBHS, MBBS degree, Dr. ABC, and for your signature. So this is the official part, and here the under the line to be detached and handed over to the relative deceased. For the patient's duty, you have done the official parts. This official part you have completed. Now you have to provide the justice as the medical ethics, the death declarations. This will be handed over to the patient, and then the patient will get the death benefits or insurance benefits. So here you it is not so difficult. You have to certify that here in the questions the deceased person, that is Mr. name, it is should be written in full name, wife of or son of or daughter of Mr. your the full name, sex in the female or male, age at 60 years or what will be the age of the patient or deceased, and religions, occupations, and the present address, police stations, and then the attended hospital. There is these conditions. You have to write the hospital name in short form, RGMCH. At this, you have to calculate this date. You have written that the which has started 4 days back, admitted. This admitted in 4 days back. So we have calculated here is the date is 6/7/2026. You have to calculate 4 days back, that is 2/7 July of 2026. So this will be calculated by your own, and there will be the registrations, hospital registration number, and expired on the date you have mentioned in your official document. And then your again the full signature of the doctor, full name, and your designation, and your medical registration. So here's how you should complete the MCCD form. And here you have to know some important points, that only one time interval between the onset of the each disease and the death, and don't mention different timelines and different periods. In practical examination, if you some details are missing, use appropriate clinical judgment to complete the remaining findings. Peritonitis, in your case, peritonitis is not mentioned in your questions, but you have to justify in your clinical knowledge. Peritoneal cavity contaminated with fecal matter, it is known as peritonitis. So you have to write this appropriate clinical judgment. Sometimes all causes are in the questions. In such cases, identify the missing links using your medical knowledge and write the complete sequence logically. Examples, another example I will give, that a hypertensive patient develops the ruptured duodenal ulcers. It is admitted in the hospital, develops a peritoneal, and dies in the next day. So how you will proceed? You will proceed the form fill up the died on, times, and hereby award, and named disease, named sex, and age of death, and the immediate cause, then the significant conditions. In this part 1 we have to write in the 1A, that is septicemia. You have to write you have the question, listen the questions, that developed a ruptured duodenal ulcer. and develops the peritonitis. Here also the peritonitis is mentioned, but what is the real cause? The real cause is the septicemia, so it is the 1A, and then the preceding causes, antecedent causes will be 1B, that is peritonitis, that is 24 hours, and last 1C is the rupture of the duodenal ulcer. This is the last most questions, and part 2, that is the patient was suffering from the hypertension and diabetes mellitus. So in the part 2 you have to write diabetes mellitus and hypertension in full. False death certificate is considered as infamous professional misconduct, not a criminal offense by itself. So the state medical council can take the disciplinary actions, including the warning, suspension, or the removal, erasure of the doctor's name from medical register, depending on the seriousness of the misconduct. So here's all about the MCCD. You can fill the MCCD form by your own. If you found this video helpful, don't forget to like this video, subscribe this channel, and share it with your classmate. If you have any doubts, leave them in your comments, and I will answer them in the next video. I will be present with another medical video. Thank you for watching, and I will see you in the next one. Thank you.